This portion of Local Lifestyles is sponsored by Ackerman Chiropractic and Fitness Center.
The subject of treating peripheral neuropathy is a touchy one for some in the medical field. Dr. Dwayne Ackerman is here to kind of shine the light on the treatment and the controversy it sort of gins up out there in the world. Good to see you.
Great to be back, thank you.
So what do you think the cause of that sort of pushback from some in the medical field?
I think the medical field moves very slowly. They get certain things ingrained that are the right way, and they're very slow to change, you know, a procedure or something like that. One of the questions I get most often is, what's causing my peripheral neuropathy? Especially for those patients that aren't diabetic. And one of the more recent theories that some researchers are starting to do, this is kind of controversial, is cholesterol meds.
The meds themselves, okay.
Yeah, because the medicines lower cholesterol. They absolutely do that, and people are on them for years and years and years.
Yes, a lifetime, yes.
Well, we know with peripheral neuropathy, the nerves don't function very well. And part of the reason they may not function very well is there's a covering called a myelin sheath on a nerve. Well, that's made up of fats and lipids. Well, cholesterol is a big part of that. So if you've been on cholesterol medicine for 10, 15, 20 years, is that affecting your nerves, you know, and slowing the nerves down because you've artificially lowered your fat content of your body that your body may or may not like? So it's possible. I mean, there's some that say no way. There's some that are going, yeah, maybe so.
Well, is research, as they say, is research being done on that topic? Because I mean, that's a big topic. That, you know, cholesterol meds are controversial anyway without that input. So, is there, to your knowledge, is there some research being done on that or a study?
Well, there's lots of stuff going on with peripheral neuropathy because it affects so darn many people as we get older, and the big risk is balance and falling.
Sure.
And if we can prevent people from falling, then we lower their healthcare costs, we improve their quality of life. You know, we know if you fall and you break a hip, you got a high probability of not making it past the next 12 months. So there's a lot of research going on to figure out how do we make people healthier longer and have a better quality of life the older we get.
Well, as you know, you shared with us many times on the show, you have so many positive testimonials. I mean, these are people who've struggled with the fear and the life of neuropathy, and they're doing better.
And they are, and we have a very, very high success rate, and it's a challenge to overcome people's perception that there isn't anything that can be done, because that's what they're told by their family doctor, neurologist, their friends, that type of thing. So overcoming that's a little bit of a challenge, but the more and more patient testimonials that we get, we've been doing this for years and years now, we're a little more convincing than we were 5 years ago because we got that track record that it does improve.
Well, it's not just you saying it now, you know, with the treatment, it's the people who have received it and are feeling better and moving better and having their life back.
Yeah, and we're not the only ones in the country doing this. There's probably 150 other docs around the country that do this, and they're getting the same results. So there's more and more positive things coming out that people are hearing, even from, you know, they may have a friend up in Indianapolis that say, hey, I heard this helps or whatever. So all that little bit helps get somebody in the door so we can find out if we can at least help them.
So just give you a call the office.
Right.
And get your free assessment there.
Yeah, free consult, free exam, no stress, no high pressure sales pitch. We're just there to see if we can help you. If we can, we'll let you know. If not, we'll let you know that as well.
All right, Dwayne, thank you so much.
Appreciate it, thank you.
More Lifestyles right after this. Please stay with us.
This portion of Local Lifestyles is sponsored by Ackerman Chiropractic and Fitness Center.